Welcome to Randall's. Let's go.
I'm Brianna.
And I'm Alyssa. And I'm Sarita. I'm Ronnie. And I'm Sam. Welcome to Randall's. Randall's Children's Hospital is focused on providing care for neonates all the way up to adolescence. The care is focused on the children and families to have the best experience that they can. Randall's is a part of the Legacy organization. Legacy is a non-profit, non-religious local organization based in Portland, Oregon that serves the Willamette Valley and Southwest Washington. Legacy is the only health system that is covered within these areas with multiple hospitals, along with its own specialized children's hospital, Randall's Children's Hospital. Randall Children's Hospital is located in the beautiful Pacific Northwest in North Portland, right off I-5. Randall's is very accessible and there are numerous ways of private and public transportation to get there. Legacy is unique from other hospitals as it is owned by the community rather than a family, shareholders, or a private sector.
The structure of Randall Children's Hospital begins with the Chief Executive Officer, beginning at the top, who is working for Legacy, which includes Randall Children's Hospital. The CEO is Catherine Correa, who had more than 20 years experience in the healthcare field. There is also a chief nursing officer below the CEO whose tasks are various and include education, leadership, informatics, care management, nursing strategy, supporting clinical staff, and working with the supply chain and pharmacy services. Nursing managers on each unit at Randall are responsible for managing the other team members on the unit, scheduling, attending meetings, managing conflicts, as well as many other tasks. The function of the organization is to provide health services to children in a wide variety of specialties. The hospital treats patients through surgery, rehab, intensive care units, laboratory studies and imaging, as well as specific specialties for patients who need focused treatment. Randall is very focused on their community and strives to provide care to benefit the whole community. The hospital wants to focus on family and creating an atmosphere with family at the center, including several projects to keep the family closer together during hospitalization, according to a nurse manager in the NICU.
Hold on. Hello?
Hi, Ronnie. You have a parent that has some questions.
Oh.
You might come to the floor.
Yeah, tell her to hold on just a minute. I'll be right there. Okay, bye. So that was my charger, so I have to report back to the floor.
Okay.
Do you mind holding Savannah for me?
No, not at all.
Okay. Hey, Sammy. I'm Ronnie. I'm working today.
Okay.
Do you mind if we walk back to his room?
Okay, great.
I heard you had a few questions.
Yeah, well, since Toby is going to be here for a while, I want to know a little bit about the core values of this establishment.
Okay, perfect. I can tell you about that. So the mission here at Randall's Children's Hospital is good health for our people, our patients, our community, and our world. So here at Randall's, we demonstrate that through the value of people and meeting the needs. So moving on, vision. So Legacy Health's vision states how we hope to impact the world and the healthcare industry in these words. So whether it's reducing our impact on the environment, researching new cures, or changing the way we deliver our care or volunteering across the globe. We do this as part to help with a healthier planet. Philosophy, we take core values such as respect, service, quality, excellence, responsibility, innovation, and leadership. So we respect, so we treat people with respect and dignity and compassion. The service, we put the needs of our patients and our families first. The quality, we deliver outstanding clinical services. We set high standards for excellent care.
We are good stewards to our resources and ensuring access to all, for all care. We are progressive in our thinking and our actions, and we serve as a role model for good health.
Oh, okay. Good to know. Thank you.
Yeah. All right, here we are. So this is Sarita. She's another nurse here. And Sarita is Sammy.
Nice to meet you.
So Toby here, while we were gone talking about the mission, vision, and philosophy, he got a peripheral inserted catheter, central catheter, located in his left saphenous vein. And Sarita's going to tell you a little bit more about it.
So, welcome to Randall's Children's NICU. I'm going to tell you about our quality improvement for central lines in this area. There is a target figure on the door, so that is to alert the nurses and anybody entering the room that this patient has a central line. So that target picture kind of looks like a bullseye. It'll alert us, so we know that before going into the patients, we need to perform hand hygiene, and us nurses also need to put on gloves. Whereas for any family members and parents, they need to know that when they see the target, that they need to wash their hands before coming in and then also coming out. So I have some hand sanitizer for you. And so also whenever you are touching your baby or anything, just make sure that everybody's always washing their hands. So hand hygiene, hand hygiene. Since your baby just had a central line put in, I'm going to teach you a little bit about our quality improvement and how to take care of the central line or what we do for that. So the central line and tubing and the caps must be changed using sterile technique. Everybody who is in the room must wear like a hair cap and a mask if they want to be in here. Other than that, they have to be outside. Whenever we change the lines, we always make sure to put an orange tag that has the date, the time, and the nurse's initials, so we know who changed it. And we do that twice a week. The doctor will be starting a parenteral nutrition with lipids on your baby. So we'll be doing that later today. So therefore, we will be changing the lipid tubing every day using the clean technique. Also make sure to do is assess the site every 2 hours. We want to make sure that we're checking the skin, just seeing how it is. Is it red? Is it swollen? We also want to check the dressing site while we're doing that. And we just want to make sure it's clean, dry, and intact. And then we also have our nurses that are audited once a quarter. They must show associated charting in compliance with tubing changes to make sure that they have been given the medicine appropriately, medications, and also that they scrub the hub for 15 seconds. So all of these aspects of standard of care that we do is done to decrease the infection rate, which is very important.
Wow, thank you for including me on how to prevent infection on Toby.
You're very welcome.
Can you tell me anything about your safe staffing ratios?
I know another nurse who can talk to you about the staffing ratios. I'll go find her and she'll be right in.
Great, thank you.
Hey, Sammy, I'm Brianna. Sarita said you had some questions about the staffing here at Randall's.
Yeah, I've noticed that sometimes the nurses have more time and sometimes they don't, and I just didn't know what you expect as the safe staffing ratios here.
We delegate our staff for their safety and for yours. So the patient to staff ratio actually changes on the level of needs of the patient and the level of needs of the parents. So in what we consider stable patients who need less care than Toby does, nurses can have up to 4 patients in a day. On patients that need more care, like Toby here on the NICU, the ratio can be 2 to 1. So, or if let's say Toby got more sick, then he would actually go to a 1 to 1 ratio. Sadly, we can't afford to do that all the time because that's not the best allocation of our resources for you or for the hospital. There's laws actually that dictate that. So every year we update it based on what we feel fits our needs best. And talking more on the subject of staffing, here at Randall's, we actually only hire BSN certified nurses. That way they're more educated on central lines and how to provide the best quality of care for Toby. Did you know that we have a residency program actually for newly graduated nurses, so they can learn specifically in our hospital how to take care of kids, because pediatric nursing is different than adult nursing. Did you know that?
No, I did not know that.
Do you have any other questions I can answer for you?
I don't think so. You answered them very well. Thank you.
Have a good rest of your day.
Thank you. You too. Today I learned all about Randall Children's Hospital, which is encompassed by the Legacy Healthcare System. I also learned about the mission, vision, and philosophy of Legacy Health. The structure of Legacy also has a CEO, a CNO, and different nurse managers that know how to best service each department. The quality improvement for babies such as mine who have central lines. Legacy is doing a lot to help prevent infection, such as making sure that everyone washes their hands, nurses are always wearing gloves whenever they touch the patient, and that sterile lining changes all the way down to the caps are performed twice a week. I also learned about safe patient ratios and how they can vary depending on the severity of a child's illness. This can range from one nurse for every one patient who is very drastically ill to one nurse for every 4 patients. Legacy Health only hires nurses with their bachelor's degrees so that they get the best care possible for their patients.
Our audit team had good communication through group chat messaging and Google document sharing. We set goals and delegated assignments. We met at least once a week. Upon a rising conflict, we opened up the conversation about how we could support each other better. We agreed to be an encouraging team and let the group know if we were overwhelmed with an assignment.
Thank you.